Hello, I'm Dr. Bhatawdekar. I'm a psychiatrist. In this series on wise parenting, we have been talking about the development of preschoolers. And we are talking about certain conditions in early childhood, which, if detected early, can have a better outcome in later years. Let me narrate a case example. There was a 5-year-old boy who was brought to me by his parents for assessment. And these parents had received multiple complaints from his school, from the teachers, and from parents of other children too. According to them, this child was misbehaving thoroughly. He would fail to sit at one place for a long time. He was extremely distractible, restless all the time, fidgeting all the time, moving about, running about, climbing here and there, barging into other children's activities and destroying their artwork, eating from their tiffins, picking up fights with them, and no amount of punishment, no amount of warnings would help this child's behavior. The teacher said to the parents that, is there any family problem? Are you not disciplining this child well? There were complaints from other parents about this child having hit their own child or destroyed their artwork or things like that. The parents were really stressed out. What was the scenario at home? It was no different. This child was just the same even at home. The only difference probably was when the TV was put on, the child would sit and watch the television for some time. Or with a mobile in his hand, he would sit and watch some images. This child was very intelligent. There was nothing wrong with his grasping power. What was missing was attention span. So, was this child doing this deliberately? Or was there a family problem? Were the parents not able to discipline him properly? Neither of these. This child suffers from a condition called attention deficit hyperactivity disorder or ADHD. And these are children who have problems which are biochemical disturbances in their nervous system, especially in areas such as the prefrontal cortex of the brain, which has a control over attention. They are unable to filter out unwanted stimuli, which we normally do. For example, if you are listening to my talk and there is some loud music at the background and you still want to listen to me, you will be able to listen to me and ignore the background music. These children with ADHD are not able to do that. They seem to respond to each and every stimulus which the nervous system is exposed to, and that's why they appear to be distractible. They're not able to focus. So, inattention, hyperactivity, and impulsivity are the three cardinal symptoms of this disorder. How do you treat this? This is not a disease, so it cannot be cured. It needs to be managed. Early detection, early evaluation, a complete neurodevelopmental psychiatric assessment is important. Some of these children might require medication even at an early stage if the hyperactivity is very severe. But occupational therapy, behavior modification, and generally channelizing this child's energy for constructive use are useful strategies. Remember one thing, children with ADHD may have normal or even superior intelligence. If their energies are channelized, if they're able to focus on the tasks in hand, they can do better. Why do we need to treat a child with ADHD? The inattention can cause impairment in academic achievement, so that needs to be treated. Hyperactivity can be a nuisance to other people. Impulsivity can lead to certain accidents in a child, or maybe certain behaviors which can be injurious to other people. It's for all these reasons that we need to treat ADHD, manage it. And one more important thing, please be sensitive to these children, even if they appear to thoroughly misbehave. They are not doing this deliberately. Their parents are stressed out because of the child's behavior, and many times parents are also helpless. So, parental counseling is another important area which is to be considered when it comes to managing a child with ADHD. We might have an entire series on ADHD sometime later. Till then, stay tuned in with our series on wise parenting.